Which of the following should not be used as sole anticoagulant for primary percutaneous coronary angioplasty? A. Unfractionated heparin. B. Bilateral. C. Fondaparinux. D. None of the above. Correct answer C. Fondaparinux. If fondaparinux is used as a sole anticoagulant during primary PCI, there is a higher incidence of catheter thrombosis. Unfractionated heparin is used in most cases, supplemented if needed by glycoprotein 2B3A receptor antagonist if needed in case of significant thrombus load. Some prefer bivalirudin in cases with higher bleeding risk instead of the above combination. Which of the following is known as spider view? A. LAO caudal view. B. RIO caudal view. C. AP caudal view. D. AP cranial view. Correct answer A. LAO caudal view. LAO, left anterior oblique, caudal view, also known as spider view. The appearance of vessels in this view resembles the legs of a spider. It is often the first view taken during diagnostic coronary angiography. Some operators prefer to take RIO caudal view as the first shot. Both these caudal views are useful in delineating the left main coronary artery and its proximal branches. As those with critical proximal coronary artery disease can potentially deteriorate fast even during angiography, it is vital to detect these lesions early in the course of the procedure. Lodixanol is a dash radio contrast. A. Isoosmolar. B. Low osmolar. C. High osmolar. D. None of the above. Correct answer A. Isoosmolar. The osmolarity of lodixanol is about 290 milliosmoles per kg and it is a dimer. Low osmolar contrasts are non-ionic monomers with osmolarity ranging from 700 to 850 milliosmoles per kg. Example, iohexol and iopamidol. High osmolar contrast agents with osmolarity of 1200 milliosmoles per kg or more are no longer used for cardiac catheterization. These were ionic contrasts of the yesteryears with a lot of associated problems. Contrast-induced renal injury does not involve A. glomerulus, B. proximal convoluted tubule, C. descending loop of Henle, D. ascending loop of Henle. Correct answer A. glomerulus. Hence, there is no hematuria in contrast-induced acute kidney injury. Predictors of contrast-induced acute kidney injury. A. Estimated glomerular filtration rate. B. ST elevation myocardial infarction. C. Cardiogenic shock. D. All of the above. Correct answer D. All of the above. These are also the strongest predictors of AKI requiring dialysis. Roxana Mehran and associates developed a comprehensive risk prediction score which included age, hemoglobin level, pre-existing chronic kidney disease, volume of contrast administered during the percutaneous intervention, need for intra-aortic balloon counterpulsation, and a few other variables. Presence of diabetes is also an important predictor of AKI. Milking effect phenomenon on coronary angiography has been described in A. Critical left main stenosis, B. Myocardial bridge, C. Coronary aneurysm, D. Coronary AV fistula. Correct answer B. Myocardial bridge. Inferior vena caval filter is deployed A. above the renal veins, B. at the renal veins, C. below the renal veins, D. below the hepatic veins. Correct answer C. below the renal veins. Inferior vena caval filter is usually deployed to prevent migration of venous thrombus from lower limb or pelvic veins to the right heart and the lung with an aim to prevent pulmonary embolism. Both temporary retrievable and permanent IVC filters are available from different manufacturers. The filters have barbs or hooks to prevent migration within the IVC. The filters are usually deployed below the renal veins under fluoroscopic guidance. Filters with delivery systems suitable for transfemoral, transjugular, and transcephalic vein delivery are available. Rarely, thrombus formation can occur above the filter, and sometimes embolization can still occur through large collaterals which can form once the filter is clogged by thrombi. IVC filters are considered in case of recurrent massive pulmonary embolism, especially when there is a contraindication to long-term anticoagulation. Short-term anticoagulation is needed after implantation of an IVC filter. Potential complications of bilateral internal iliac artery occlusion due to a stent graft. A. Gluteal claudication. B. Erectile dysfunction. C. Bowel ischemia. D. All of the above. Correct answer D. All of the above. Gluteal necrosis can occur in severe cases of gluteal ischemia. Bladder ischemia is another potential risk. Coil embolization of internal iliacs is resorted to for preventing type 2 endoleak when the aortic stent graft needs to be extended into the external iliac arteries. Very late stent thrombosis is stent thrombosis after A. 1 month, B. 3 months, C. 6 months, D. 12 months. Correct answer D. 12 months. Important causes of very late stent thrombosis are malapposition, neoatherosclerosis, stent strut uncoverage, and underexpansion. Very late stent thrombosis is a feature of early generation drug-eluting stents, less common with newer drug-eluting stents. It is a potential risk for withholding antiplatelet agents for surgical procedure. Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.